It's not even on the right page. Rip. Okay, hold. Hello, my name is Katie Marks, and today I'm going to be giving a presentation on anxiety. What is anxiety? Anxiety is the feeling of fear, worry, uneasiness, and dread. What are some of the causes? Some causes of anxiety are mental conditions, physical conditions, effects of the drugs that you are required to take, panic disorders, generalized anxiety disorders, phobic disorders, and stress disorders. What are some of the effects that anxiety can have? Anxiety affects the central nervous system, both decreased and increased concentrations of thyroid hormones. Too little thyroid hormones tend to feel sluggish, and too much induces anxiety and nervousness. It also affects the immune system and affects several neurotransmitters in the brain. The forebrain is the most affected with people who have anxiety. Several organs are also affected due to anxiety. It affects the skin and causes major problems like acne, blisters, psoriasis, random breakouts, and eczema. It also affects the brain. You can experience headaches or migraines and tensions in the muscles. Your stomach is also very sensitive to stress while having anxiety. It also affects how our intestines function. The pancreas, due to the high blood pressure, breathing rates, heart rate increases, and blood sugar levels, and you produce way more insulin than needed and can damage arteries. You're more at risk for diabetes and obesity and can contribute to Syndrome X. So a generalized anxiety disorder is excessive and unrealistic to worry about over a period of 6 months. Some symptoms of this includes restlessness, fatigue, difficulty concentrating, irritability or explosive anger, muscle tension, sleep disturbances, and personality changes like becoming less social. Panic attacks are also a common sign of anxiety. These are intense periods of pain or feeling of doom developing over a very short time frame, up to 10 minutes. Symptoms of panic attacks include sudden overwhelming fear, palpitations, sweating, trembling, shortness of breath, sense of choking, chest pain, nausea, dizziness, a feeling of detachment from the world, fear of dying, numbness or tingling in the limbs or entire body, and chills or hot flashes. Some treatments for anxiety include medication, psychological counseling, handling it independently, or other treatments consisting of psychotherapy, behavioral therapy, and medications. Some self-remedies you can take are to learn how to manage the stress in your life, commit to taking the time away from study or work, learning a variety of relaxation techniques, practicing deep abdominal breathing, learning to replace negative self-talk with coping self-talk, talking with people who are very supportive, meditation, exercise, long warm baths, and rest in a dark, isolated room. Cognitive behavior therapy is another way you can help cope with anxiety. Cognitive behavior therapy helps recognize and change the patient's thinking patterns that are associated with the anxiety and troubled emotions. This treatment limits distorted thinking and a behavioral part designed to change the way people react to the objects or situations that trigger anxiety. Psychotherapy consists of talking with a trained mental professional, psychologists, social workers, or other counselors. How can I prevent anxiety? Well, good ways to prevent it are reducing your caffeine and tea intake, reducing your chocolate consumption, checking with a doctor or pharmacist for over-the-counter herbal remedies, exercising regularly, maintaining a healthy diet and eating healthy foods, keeping a regular sleeping pattern, seeking out counseling and support after traumatic or disturbing experience, and avoiding alcohol. Anxiety affects people in many different ways. It can affect your life by complicating your friendships, causing problems at work. It can increase a person's feelings of isolation and lack of confidence, and develops a substance abuse like smoking or addictions and overeating. Many health problems that occur with people who have an anxiety are insomnia, digestive or bowel problems, damage to your kidneys, damage to your blood vessels, and damage to your heart. In conclusion, anxiety is fear, worrying, uneasiness, and dread. It can affect the central nervous system and immune system. It can affect the brain and stomach. It can be treated medically, counseling, or independently. And prevention to reduce anxiety is caffeine, eating healthy, or keeping a regular sleeping pattern. Thank you for your time.